Health workers in Nigeria have described as inhuman and insensitive the payment of 5,000 naira to them as a monthly hazard allowance. But the government appeals for their understanding in view of the devastating effects of COVID-19 on the economy. TVC News correspondent Joke Adisa reports.
According to UN Ops, between April and June 2020, mortality.
The outbreak of COVID-19 in Nigeria in February 2020 placed more burden on an already belabored medical workforce. Many health workers have died of COVID-19 in their efforts to save the lives of those infected. This sad development reinforced their resolve to clamor for an improved hazard allowance and other demands. It is one of the reasons for the just suspended nationwide strike of resident doctors.
I feel very pained that we're talking about 5,000 naira as hazard allowance, even in the face of severe risks. 5,000 naira, and I have told people that nobody should hear that doctors are being paid 5,000 naira allowance per month.
Present hazard allowance, standing in tune with the enemy president. I will not mention it because it is provoking. It's long overdue for review.
At this meeting, the federal government seeks the understanding of the health workers, even as it appreciates their sacrifice. Government representatives here blame the downturn in the economy on COVID-19 outbreak.
The revenue has crashed. We have to, in his own words, search for money. Search for. That is exactly the word. And if searching for what again, for that money is also a collective responsibility. Although government takes the lead, we own government. And you here, everybody here owns government.
I want to clarify the issue of embargo on employment. It doesn't affect the medical and defense. They were given exemptions. The only thing is that they have to apply to the Ministry of Health for Health people and the head of service or the federation if necessary, so that they can be captured.
After the technical session, which lasted several hours away from the full glare of cameras, both parties agreed to meet again.
Bringing percentages of the increments they will need on the existing hazard allowance. And there was a proposal for block money, lump money, and a proposal for percentage of. So these are things we are putting on a weighted scale. They also
I've said it should be 65 from level 1 to 6, irrespective of whether the CONS is adjusted or not per month. Then for CONS 7 to 9, we have asked if the CONS is adjusted, then it should be 80%. But if it is not adjusted and it's to be done, then it should be 90%.
Joke Adisa, TVC News, Abuja.